Welcome to Facts TV News, where everything is true. COVID crisis at Mandeville Hospital. The spike in novel coronavirus cases in this South Central parish continues to worsen, with health officials reporting a crisis at Mandeville Regional Hospital, where up to yesterday, 34 staff members have tested positive for COVID-19. Additionally, the hospital is stretched with a full isolation ward and patients being moved from other wards into isolation after testing positive for the virus. Acting Medical Officer of Health, Dr. Blair Walters, told the multi-meeting of the Manchester Municipal Corporation yesterday the health officials are trying to minimize the risk of spreading the virus at the hospital. The Mandeville Regional Hospital has cases not only on the isolation ward. Based on these numbers, the hospital is a regional facility. It has cases not just from the parish of Manchester. There are cases for many other parishes, she added. We have now exceeded our capacity on the isolation ward. We do have cases that are found on the other wards. We are trying to manage those as best as possible to reduce spread to other individuals, she added. Southern Regional Health Authority SRHA Director Bent said yesterday that there were 26 COVID patients admitted at the hospital, while staff from the operating theatre and 6 other wards are in isolation. The SRHA, which has oversight of the facility, in a press release yesterday said since last March, 61 of the hospital's 780 staff members have contracted the virus, of which 27 have fully recovered and are back at work. A surge plan has been activated to manage the overwhelming numbers of COVID patients and reduce staff complement. Bent reiterated the availability of other facilities for recovering patients. The surge plan's first year includes reproposing an additional ward to serve as a 16-bed isolation ward and distribution of patients who can be managed at other hospitals in the region. In addition, there is a 30-bed facility at the Kendall Camp and Conference Centre in Manchester and a 12-bed facility at Front Hill St. Elizabeth for recovering patients who do not need hospitalization, he said. He also sought to ease public concern about the situation at the hospital. We assure the public that while we are stretched, we are not broken. As from the onset of the pandemic, we have anticipated most of the challenges we now face. We continue to serve the public in the best way possible in all areas of healthcare, thanks to our dedicated team, he said. Meanwhile, Dr. Blair Walters said healthcare workers were not necessarily infected while on the job. Just like other persons in our community, there are times when health workers drop their guards. Globally, it has been observed that healthcare workers tend to drop their guards outside of the workplace, so many times they become infected not on the job but outside of the workplace, she said. Sometimes they fall prey to the infection in other circumstances. This is not to say that they may not pick it up at the hospital, she added. The hospital's CEO, Alwyn Miller, disclosed that investigations reveal that 10 of the active cases are likely to have been contracted outside of the hospital. He reported on Wednesday that an assessment would be done of the operating theatre after 27 of its staff contracted COVID-19, but stated that there were sufficient staff members to attend to emergencies. In Manchester Northeastern, Percy Junior Hospital is being closely monitored. There is a similar picture happening at the Percy Junior Hospital, not yet bursting at the seams, but a great concern, Dr. Blair Walters said. She disclosed that hospitals in the southern region, Clarendon, Manchester, and St. Elizabeth, are reporting similar situations. Manchester, up to press time yesterday, had recorded 1,279 confirmed cases, 402 of which were active, and 40 deaths. As it relates to the COVID-19 situation in Manchester, our cases spread right across the parish. We, however, have noticed a concentration of cases mostly centrally, that is, Mandeville and its immediate surrounding communities. We also have a concentration of cases in the northern sections of the parish, she said. We have seen increases in the south, but those cases are less than in the north, she said, adding that 7 of the deaths occurred in the last week and a half to 2 weeks. The doctor also said the health department operating center is at its wit end at this time receiving calls, making calls, and ensuring that those particular individuals with active cases are given their information and are checked upon to ensure that they are following the guidelines. In recent days, we have hit some high numbers. We have never had those numbers before, and certainly these numbers are not necessarily reflecting behaviors today, but those prior to, and we are now reaping the consequences of those behaviors, she added. Our emphasis really is to stop and get people to think about their behavior and to change. The numbers will continue to rise if we do not change our behavior, she added. Mayor of Mandeville, Donovan Mitchell, was unhappy with the situation. We are in a crisis in the parish. We would all have been reading or realizing what is happening in the parish somehow. Something seems to be falling on deaf ears. The health service in the parish are not too far from a crisis. We can't take business in the parish as usual, he said. Michelle Obama to team up with puppets for a kids' food show. Michelle Obama is launching a Netflix children's food show with a pair of puppets to bring a bit of light and laughter to homes around the world. The new show, called Waffles Plus Mochi, launches March 16 and will be all about good food, discovering it, cooking it, and of course eating it, the former First Lady posted on Tuesday. The 20-minute episodes will combine live action and puppets, and Obama will be a series regular. The show centers on two best puppet friends who dream of becoming chefs and travel across the world looking for ingredients and making dishes alongside renowned chefs, home cooks, kids, and celebrities, according to a press release from the show. Kids will love it, but I know that adults will also get plenty of laughs and some tips for the kitchen, Obama wrote. In many ways, this show is an extension of my work to support children's health as the First Lady. And to be quite honest, I wish a program like this had been around when my girls were young. The show is produced by Higher Ground Productions, the production company owned by Obama and her husband, former President Barack Obama. In 2018, the Obamas signed a multi-year agreement with Netflix. Michelle Obama released her Netflix documentary, Becoming, in May. The former First Lady is also host of the Michelle Obama podcast on Spotify. 72 COVID-19 beds ready, 133 overall to be added. An additional 72 hotel beds are to be added to the national count as the Ministry of Health and Wellness is to commission 2 new facilities into service to deal with the ongoing spike in the COVID-19 positive cases on the island. According to Portfolio Minister Dr. Christopher Tufton, the officials at the ministry anticipated that more beds would eventually be needed in the system, and provisions were made with ground broken at St. Joseph Hospital in Kingston and Falmouth Hospital in Trelawney some 5 weeks ago. According to Tufton at the weekly COVID-19 press briefing on Thursday, the facility at St. Joseph was visited and the work has been completed and will be able to provide an additional 36 beds to the 362 national COVID-19 beds that the government had prepared before the start of the pandemic. He said on Friday the ministry's team will be visiting the new facility at Falmouth, which he said is almost completed and should be ready within the next few days. He said that facility will also add another 36 beds to the total COVID-19 bed count. The minister stated that St. Joseph Hospital would also be redeploying 21 beds to be used specifically for COVID-19 cases. According to him, the field hospital, which was donated by the United States government, which was originally planned to be situated at the National Chest Hospital in St. Andrew, will be moved to the Spanish Town Hospital in St. Catherine. Dr. Tufton noted that this will add 40 beds to make the total number of additional beds to be available shortly at 133. Please remember to subscribe, like, share, and click the notification bell for daily updates.